what is called as the ulcer? Ulcer is a break in the continuity of the covering epithelium due to the death of the cells. Suppose this is your epithelium, there is a break in their continuity, then this will leads to the ulcer, and this will lead to the death of the cells, and cell deaths in the skin and the mucous membrane. This will all leads to the ulcer. So this is a normal definition of the ulcer. Now what is a diabetic ulcer? Ulcer which occurs due to the diabetes or occurs in the patient with the diabetes, that type of ulcer will be called as the diabetic ulcer. Now patient with the diabetes are having more chances of occurring this type of diabetic ulcer. Now what are some of the causes of the diabetic ulcers? Increase in the glucose in the tissues, which will precipitate the infections. Now increase in the glycosylated hemoglobin and the tissue protein, which will decrease the O2 dissociation. Remember, increase in the glycosylated hemoglobin and the tissue protein will decrease the O2 dissociation. Now, diabetic neuropathy. The diabetic neuropathy will involve the sensory, motor, and the autonomous components, and the atherosclerosis. These are the mainly causes. Now, diabetic ulcer occurs due to the clawing of the toes, loss of function of the foot arch, and the decreased body immunity. Now what is a main site? Main site of the diabetic ulcer, we can say that is a toes and the feet are the main sites of the diabetic ulcer. Other sites we can say leg and the scrotum, but remember the most common sites is the toes and the feet. Now the diabetic ulcer is a very much deep and the spreading. In the picture we can see that the deep and the spreading ulcer. This is a deep and the spreading type of the ulcer. So we study that the diabetic ulcer is what? It is ulcer which occurs in the patient with diabetes. It is a deep and spreading. The four causes: increasing the glucose concentration in the tissue, glycosylated hemoglobin and the tissue protein, diabetic neuropathy, and the atherosclerosis. Now what are the investigation, that how can we find whether it is having a diabetic ulcer or not? First, check the blood sugar level. We can check both blood sugar, that the random blood sugar and the fasting blood sugar level. Now during you use the urine ketone bodies test. In the, if urine ketone bodies increases, is ketone bodies in the urine increasing, then we can say they having a diabetic ulcers. Now what are having doing while the x-ray of that part and using the arterial doppler effect. Arterial doppler effect, we know that using the ultrasound technique we do the arterial doppler effect of the limbs. Here you can see in the picture, this is a diabetic foot and is having the ulcer. See, ulcer, this some patches type form in the foot, and this will lead to the ulceration and the painful in their foot. Now what are some of the treatments for the diabetic ulcer? The main and the golden treatment is your insulin. Remember, insulin is your golden treatment, but if there is a ketosis, then you should prefer the human insulin is preferred in ketosis, and intravenous insulin is preferred in with the normal saline. Okay, now you should give some nutritional supplements. These are the part of your treatment. You should give some antibiotics. You should do the regular dressing, cleaning of the patients, and you should be the skin graft. If granulation starts, then cover the ulcer with the skin graft, or you can say the flap. Not abscess drainage below the knee or above the knee. Okay, now these are the some of the treatments of the diabetic ulcers. You can all memorize and take the screenshots or of the notes, and these are the very much short, and follow the channel crime this. Thank you for it. Okay.